Hello, everyone. This is Dr. George Gonzalez. I'm the founder of Quantum Neurology and the author of the Holographic Healing Series. And I'm so fortunate to be here today with a very good friend of mine, Dr. Elizabeth Sheehan. And she is an expert in quantum neurology and an expert in many other areas, including evaluating people's blood work and helping them deal with chronic infections. Hello, Elizabeth. Thank you for being here. And also thank you for being a speaker at our November 11th, 12th event. Please come. Okay, go ahead, Elizabeth. How are you?
Awesome. Thanks, George. It's so good to see you.
Good to see you too. You know, I'm so excited to hear about your talk. Why don't you tell us about it?
So my talk this year is going to be on the evaluation and reintegration of primitive reflexes through a quantum neurology filter or standpoint, through our quantum neurology rehabilitation that we do.
I love it. So how long does it take you to do that evaluation, or when would you do the evaluation, I should say?
Well, primitive reflexes are very interesting. There's a lot of reflexes that come on in utero, serve a very specific purpose, and then sometime after birth, depending on the reflex, it could be 2 to 3 months after birth or 8 to 9 months after birth. Then they're supposed to kind of fade away or actually more integrate into the nervous system and higher nervous system pathways. And we find that many things interrupt the full integration of these primitive reflexes. Just like with our other quantum neurology concepts of injury to myotomes, injury to cranial nerves, we can also have what you would call integration injuries, where these reflexes have not completely integrated into the symphony of the rest of the nervous system. And these unintegrated primitive reflexes can then cause a huge variety of different injury, illnesses, conditions, and symptomology. So things that especially affect children, like ADD or ADHD, autism, motor issues, sensory issues, vision and auditory issues, those are all different things that can actually be being caused by primitive reflexes that are unintegrated. But even adults can be experiencing things that are due to unintegrated primitive reflexes, such as chronic back pain, irritable bowel syndrome, obsessive compulsive disorders, chronic shoulder injuries, Parkinson's, Alzheimer's have been linked to unintegrated primitive reflexes. So really there's a wide variety of neurological things or things that we see in our office that we may not be getting full results with our myotome and cranial nerve and sensory and all of the other things we do in quantum neurology. So it might be the next step to look at is these primitive reflexes and getting those evaluated and getting them reintegrated into the hologram of the nervous system.
Absolutely. I love it. And you know, when I think about this concept, I think about, the tone of the nervous system. And when we're talking about the tone of the nervous system, an easy thing to understand this concept is when people get cold sores or herpes or herpes outbreaks. And what happens is it's said that everybody has this virus, but it's only under stress that these viruses erupt. So when somebody has a lot of stress in their life, the nervous system tone is weaker and the eruption occurs. And as the person's constitution improves, their nervous system is able to contain that virus. The same idea happens with neurological reflexes. And one way to look at this is the Babinski reflex, which is you brush the bottom of the foot and make like the number 7. And if the toe arches back and flares away from the foot, that's considered to be a positive neurological finding, which is a negative thing to happen to a person. It's not good for them. And what happens is when we're developing, that's a normal reaction as a child or as an infant. That's a normal reaction. And when the nervous system tone develops sufficiently, it is able to contain that reaction. And if somebody gets damaged from a brain injury or a stroke or otherwise, then we do that test, and if we see that come back, that's evidence of nervous system collapse or nervous system decline in that area. So those are important concepts to understand. These primitive reflexes, whether they were there originally and then were damaged at some point in life, or they never developed from the start. These are very important reflexes, such as the suckling reflex, which is the first reflex that we have when we're born. It's the reflex that allows us to suck, swallow, and eat for the first time. And if those reflexes don't engage, then you have that child that has difficulty eating or difficulty breastfeeding and those kind of difficulties. And that's just one example of many, many other primitive reflexes that are necessary to develop. Isn't that right, Dr. Elizabeth?
Yeah, that's exactly right. I like that you brought up Babinski. I mean, that's one of the ones we learn in school. It's one of the ones we at least kind of tend to retain in our memory. And a not well integrated Babinski or re-injured Babinski reflex is one of the ones that'll cause people to have, as adults, chronic foot issues like flat arches and bunions. And it's one of those ones that contributes to Parkinson's and Alzheimer's, interestingly. So that's that Babinski one is kind of interesting. And you might not get on the classic reflex test a real strong positive Babinski, but if we apply it in the quantum neurology concept and do our neurological recognition testing at the same time, then you may find where the weakness or where the issue is, start to correct it and upregulate it, and then see how the nervous system responds.
You know, that's exactly right. And for those people who don't understand that principle, what Dr. Elizabeth is talking about is making the evaluation and the body's response holographic, which means that every part of the nervous system is engaged in that activity or reaction. And so when we train the body in this, it's a rehabilitation strategy that we apply through quantum neurology. We're able to see the nervous system engage in itself and find its way to doing these actions. And that's through the reflexive action of the body. The simple way of saying that is we stimulate the body in a way that we achieve a desired result. So we use the body's natural actions and reactions to achieve a desired result. And an easy way to explain that is if, you know, when you hit the reflex on your leg, it makes your knee kick out. And if somebody has difficulty extending their leg, I could use that reflex to help them straighten their leg. And that's just a simple concept of what we're talking about here. Dr. Elizabeth is talking about using primitive reflexes that all infants should have and develop, and if they don't develop properly, we have difficulties later on in life or throughout childhood. And by stimulating these reflexes and creating the holographic communication, considering these reflexes, we found that to be very special, very beneficial. So what kind of things, Elizabeth, are you seeing shift in your patients that you're doing this on?
So some of the things that I'm seeing changes with are better gross motor development in kids. You know, right now my primary patient base is working with Down syndrome and still autism, and working on the proper integration of these primitive reflexes is helping a lot and very quickly with motor skills, both gross motor skills as well as fine motor skills. We're seeing changes with cognitive processing, so better visual processing, better auditory processing. I have a patient, really complex case, and she's having really great changes with her stamina and her hypotonia. Before, she was only able to walk like a block without having severe fatigue and possibly pain. She is not able to communicate pain especially well. But, you know, when you have a child that just kind of all of a sudden collapses and doesn't want to be touched and is also having high anxiety, I mean, those are some nonverbal indicators that there may be some pain involved. And she's doing phenomenally. She's able to walk really great distance. She's able to go up and down the stairs. we're even seeing changes with children's growth. They're starting to have some growth spurts. So it's a wide variety of different things that I'm seeing by having these reflexes become better integrated within the whole hologram of the nervous system. And then in my adult patients, what I'm doing is I'm testing to see which ones to do or which ones I need to maybe take a look at. And I'm especially looking at my patients that are suffering from, long-term chronic illnesses, and those patients that are kind of always stuck in fight or flight. And no matter what kind of adrenal or neurotransmitter support you give them, they're still kind of locked in there, even though they're doing like the right lifestyle modifications, and they're meditating and they're exercising and all that kind of things. Because there's different reflexes, like an unintegrated or a faulty integrated Moro reflex will keep a patient stuck in fight or flight, and it has a really direct connection with the vagus nerve. So if you find like a vagus nerve that's kind of chronically re-injuring, and you've kind of troubleshooted all the other things, it could be the connection with a not well integrated reflex that's having that influence on the cranial nerve system, having that influence on the endocrine and neurotransmitter system.
That's a whole lot of things that could happen, of course, and I'm familiar with this topic, but I'm sure that's new for many people. And so how long does it take you to evaluate and correct these type of reflexes, and how long do those corrections last for?
Yeah, that's a great question, and it's actually something I'm still working on, because I'm really trying to find a way to take all of these reflexes, really streamline the testing. As you know, since you developed quantum neurology, activating the actual nervous system and the function you're trying to correct is that's what we do with quantum neurology. So with a lot of these reflexes, it's putting people in the positions of mimicking what the reflex should do. So, like Babinski's an easy one, you can stroke the bottom of the foot, but the Moro reflex is a little more difficult. You have to put the patient in a very certain position, kind of get them in like a startle position and things like that. So depending on the reflex, sometimes it's very simple. Sometimes it's a little more complex, but nothing more than, a minute or so. I'll be bringing to Homecoming a really great questionnaire that I get absolutely no credit in creating. I got this from a very brilliant gal who has done a lot of this work with the primitive reflexes. It's her questionnaire that she came up with, but it'll be interesting for everybody to take a look at that, because it goes through like history, like did you have a difficult birth? Was it a cesarean birth? Because each reflex will have a different set of factors that go with it as far as its likelihood of unintegration. And then you'll have some sensory things, like with this particular reflex, there'll be sensitivity to light and sound. With this reflex, you'll find that a person can only do their homework if they're laying on the ground. They can't sit and do homework. They have to lay on the ground. So this questionnaire will be another great way to kind of look at your patient, go through and be like, you know what, I think let's check these couple of reflexes on you. You fit this pattern. It only takes a little bit of time to correct. Like most of our quantum neurology corrections are relatively quick. And as far as if it stays corrected or if it re-injures, that varies very much on the patient and how their nervous system is responding and other factors. But overall, I would say the corrections are doing very well.
And that's exciting to hear. And, so when patients are interested in getting a hold of you, Elizabeth, and consulting with you, how would they do that?
They could email me. My email is experiencehealth@aol.com. My website is experiencehealth.info. Our office number's 425-408-1620. And those are there goes the phone right now. Look, it's already working.
Already working. I love it.
So, but yeah, those are the main ways to try to get a hold of me.
Okay, excellent.
Or you can go onto the Quantum Neurology website under the practitioner locator, and I'm in Washington State, so you can try to find me there. live hangouts.
Yeah, and you've spoken for us before at the homecoming events, and we've loved everything you've shared. Wow, you're just the most popular person right now.
Oh, I don't even know what to do. I keep hanging up. I will call you right back. Thanks. Okay.
All right. Well, thank you so much for being here with us, and we appreciate your time. And we look forward to seeing you at the homecoming event, November 11th and 12th of 2016. We're going to be there with several other speakers and workshops. And please bring your staff, your family members. And this is the first event, a homecoming event that is open to anybody interested in coming. So please bring your friends, and if you have doctors that are interested in quantum neurology, this would be a great event to come to learn about quantum neurology, to experience it firsthand, and see the advancements that are happening within our community. Thank you so much, Elizabeth, for being with us. And if you want to get a hold of us, you could call us at 323-653-2818 or info@quantumneurology.com. Thank you, Elizabeth. It was great talking with you.
Thank you. See y'all at homecoming.
See you there.